Hello, I'm Bob Estherhay from the School of Public Health and Information Sciences at the University of Louisville in Louisville, Kentucky. I've been asked to present an idea that accountable care organizations might consider, and that's the adoption of mobile and information communication technologies for patients. And the example I'm going to use is asthma in children and adolescents. The challenge to try and do something like this is really centered on community informatics. And what that means is identifying all the stakeholders across the community that have or may have an interest in the quality and cost of care for children and adolescents with asthma. Getting parents, schools, and public health, not just purchasers, payers, providers, and physicians to participate as stakeholders is one of the first challenges. Another challenge is bringing all these people together for face-to-face meetings and facilitating those meetings to get them to know each other on a first-name basis, interact with each other, and if they're interested and agree to participate, then going ahead and helping them co-create a vision and value proposition for healthcare, prevention, and education for all citizens across the community that have asthma. The success requires development of two types of networks. Inter-organizational networks, that's the people, organizational, and societal issues that one will be confronted with, and the other is the information technology networks. The major problem, 80 to 90% of the problem, are always people and organizations, and information technology is much less of a problem in trying to do a community-wide project of this nature. So this is the challenge. How do you get these two networks to be able to work together across your network to achieve what you set out to achieve? So why should accountable care organizations use information and communication technologies? Well, for the first time, we can reach almost everyone in the world in an instant just by simply calling them. There's never been an information and communication technology for such a low cost. And mobile information and communication technology is a powerful tool, as I mentioned, for healthcare, prevention, and education. And mobile information and communication technologies has the promise of helping decrease the utilization of healthcare services and unnecessary hospitalization for patients with chronic disease such as asthma. So what is AsthmaPal? Well, it's an information and communication technology, as I mentioned. It's an application for children and adolescents with persistent asthma using cellular, in this case smartphone, and cloud computing technologies to help them better manage their asthma. AsthmaPal is a new cost-effective intervention for improving the control of asthma for at-risk populations in low-resource settings. And it has a potential opportunity to make a mobile global health impact on improving the control of asthma worldwide. Here you see a slide which shows a smartphone on the left and a cloud on the right filled with various applications, including AsthmaPal. The interesting facts are that there are over 6 billion people in the world with now over 4 billion cell phones, and that 42% of Americans owned a smartphone in December 2009, despite the recession, and that 2/3 of physicians used smartphones in 2009. And as of February 2010, a year ago, there were 5,805 health, medical, and fitness applications available in the Apple App Store. So in conclusion, this approach requires leadership and collaboration across the community to be successful. It requires understanding community informatics, which in turn requires a foundational understanding of medical or health informatics. It requires an understanding of community informatics, which in turn requires an understanding of community dynamics. What's the relationship? Who are the people? Who are the organizations that have relationships across your community? And how may they be engaged? I hope this brief video starts an engaging conversation by the audience and in your community. Thank you.